Hey everyone, welcome in. Today we're going to be taking a deep dive into something called hypertriglyceridemia. It might sound a little intimidating at first, but stick with us. By the end, you'll not only know what high triglycerides are, but also why they matter for your health. And most importantly, what you can actually do about them. We've dug into the latest research and expert guidelines to break it all down for you.
This is one of those conditions that often goes unnoticed. You might not even feel any different, but it's definitely something you want to be aware of.
Absolutely. Like so many things in health. It's about prevention and catching things early. So let's start with the basics. What exactly are triglycerides, and why should we be paying attention to their levels in our blood?
Well,
Yeah.
you can think of triglycerides as these tiny packages of energy, or fat, that are circulating in your bloodstream. Now, we do need some triglycerides for our bodies to work properly. They're fuel for our cells. But when we have too many of them just hanging around,
Yeah.
that's when things can start to go wrong.
Okay, so we've all heard about cholesterol and how it relates to heart health. Where do triglycerides fit into all of that?
That's where things get really interesting. High triglycerides are a key factor in something called metabolic syndrome. It's like a cluster of risk factors that really increase your chances of developing heart disease, stroke, and even type 2 diabetes.
Oh, wow. So it's not just about the triglycerides themselves. They're part of a bigger picture when it comes to our metabolic health. What else is involved in this metabolic syndrome?
Good question. So in addition to those high triglycerides, you're also looking at things like high blood pressure, high blood sugar, low good HDL cholesterol, and even excess fat around the waist. If you have 3 or more of these factors, your risk for those serious health issues goes way up.
So it's almost like high triglycerides are a warning sign, like a red flag that something might be out of balance. And if you don't take care of it, it can set off a chain reaction of other problems down the line.
Exactly. And here's the scary part. High triglycerides often don't cause any noticeable symptoms. You might not even realize anything's wrong until a serious complication develops, like pancreatitis.
Pancreatitis, ouch, sounds painful. That's inflammation of the pancreas, right? What's the connection between that and high triglycerides?
So, when your triglyceride levels get really high, usually around 500 milligrams per deciliter or higher, it can actually trigger a sudden inflammation of your pancreas. This can cause intense abdominal pain, nausea, vomiting, and you might even end up in the hospital.
500 milli GDL, that's a number I'm going to remember. So knowing all of this, how do we even end up with high triglycerides in the first place? Is it all about diet and lifestyle? Or are there other things that can contribute?
Lifestyle choices definitely play a big role. A diet that's high in sugar, refined carbs, and those unhealthy fats, like saturated and trans fats, can all lead to elevated triglyceride levels. And of course, lack of exercise and carrying extra weight are major contributors too.
So it's not just about cutting fat altogether, but being smart about the kinds of fat we're eating.
You got it. You want to focus on the healthy fats, like those found in olive oil, avocados, nuts, and fatty fish. These unsaturated fats can actually help improve your overall cholesterol profile.
Okay, so good fats in, bad fats out. What about alcohol? I've heard that can affect triglyceride levels too.
Alcohol is a big one. When you drink alcohol, your liver breaks it down into triglycerides. So if you're drinking too much, those levels can really spike.
So maybe it's time to rethink those nightly glasses of wine. But it's not always about lifestyle, right? Sometimes high triglycerides can be a sign of an underlying medical condition.
You're absolutely right. It's not always as straightforward as diet and exercise. There are certain medical conditions that can cause elevated triglycerides, like diabetes, hypothyroidism, kidney disease, and even some genetic disorders.
If your triglycerides are high, it's really important to get checked out by your doctor. They can figure out what's going on and come up with the best plan for you.
Exactly. And speaking of talking to your doctor, it's also important to be open about the medications you're taking.
Oh, interesting. You mean some medications can actually cause high triglycerides?
That's right. Some common medications, like beta blockers, certain hormone therapies, and even some medications used for acne or mental health conditions can have an impact on your triglyceride level.
Wow, I never would have thought of that. So it's not just what we're putting into our bodies, but also how our bodies react to certain medications. It really shows how important it is to have a good relationship with your doctor.
Absolutely. They can review your medications and make sure nothing is contributing to your high triglycerides.
Okay, so we've established that high triglycerides are a serious issue. But the good news is that there are things we can do about it. What are some of the strategies for managing high triglycerides?
Yeah.
and bringing those levels down.
Well, as we've touched on, lifestyle changes are always the first line of defense.
Right. Diet, exercise,
Yeah.
weight loss, if needed. But let's dive a little deeper. What kind of diet works best? And what types of exercise are most effective?
When it comes to diet, it's all about focusing on those healthy fats, complex carbs, and fiber-rich foods. Load up on fruits, veggies, whole grains, and lean protein sources.
So ditching the white bread for whole grain and choosing grilled chicken over fried can actually make a difference.
Absolutely. And don't underestimate the power of fiber. It helps regulate your digestion and can actually bind to some of the fats in your gut, preventing them from being absorbed into your bloodstream.
Fiber's like a superhero.
Oh, wait.
What about exercise? Any insider tips when it comes to exercise and triglycerides?
Aerobic exercise is your best friend here. Think brisk walking, swimming, cycling, anything that gets your heart rate up for at least 30 minutes most days of the week. But here's a fascinating little tidbit. Studies have shown that exercising the day before you have a higher fat meal can actually help blunt that triglyceride spike.
Wait, seriously. So if I know I'm going to have a big indulgent meal, I should hit the gym beforehand.
It's like giving your body a head start on processing those fats.
That's incredible. Okay, so we've got diet, exercise. What about weight loss? How much of an impact can that have on triglycerides?
Even losing a small amount of weight can make a noticeable difference. Studies show that losing just 5% to 10% of your body weight can significantly lower those triglyceride levels.
So even small changes can add up to big results. But let's be real. Sometimes lifestyle changes alone aren't enough. What about medication? Are there drugs specifically for high triglycerides?
There are. Fibrates are a class of medications that are very effective at lowering triglycerides. They work by decreasing the liver's production of triglycerides and increasing their breakdown.
Okay, so they kind of attack the problem from both sides. What about those omega-3 fatty acids we always hear about? Do they help with triglycerides too?
Omega-3s can definitely play a role, but there's a big difference between the supplements you find over the counter and the prescription versions.
Okay. So popping a few fish oil pills might not be cutting it?
Right. Prescription omega-3 fatty acids are much more potent, and they've been specifically studied for their effects on triglycerides and heart health.
So we're talking about different dosages and formulations.
Exactly. The prescription versions have much higher levels of EPA and DHA, which are the specific types of omega-3s that have been shown to be most beneficial.
EPA and DHA. Those sound familiar. Aren't those the things listed on my fish oil supplement label?
Yes, but the key difference is the concentration and the research that backs them up. Prescription omega-3s have gone through rigorous clinical trials to make sure they're safe and effective.
Got it. So when it comes to managing a specific health condition like high triglycerides,
Yeah,
it's important to go with treatments that have been scientifically proven.
absolutely. Now, another medication that often comes up when we talk about heart health is statins. Have you ever wondered if they play a role in managing triglycerides?
Yeah, I was actually just thinking about that. Aren't statins typically used for cholesterol?
That's right. Statins are primarily known for lowering LDL cholesterol, which is the bad cholesterol. They do have a modest effect on triglycerides. But if your triglycerides are really high, other medications like fibrates or those prescription omega-3s might be more effective.
So it's all about choosing the right tool for the job.
Mm.
Statins for LDL
Right.
and other options for high triglycerides.
Precisely. And remember, the best treatment plan is going to be different for everyone. It depends on your individual situation and risk factors.
Right, which is why those conversations with your doctor are so important. They can help you assess your risk and figure out the best way to move forward.
Absolutely. It's a team effort.
Okay, so we've covered a lot of ground in this first part of our deep dive into hypertriglyceridemia. We've talked about what triglycerides are, why they matter, what can cause those levels to go up, and some strategies for getting them back down. But there's so much more to explore. In the next part of this deep dive, we're going to delve into the potential complications of untreated high triglycerides and discuss the latest expert guidelines for diagnosis and management. Stay tuned.
I'm looking forward to it. You know, it's amazing how interconnected our bodies are. We've been talking about triglycerides and their role in heart health. But did you know that high triglycerides can actually have implications that go way beyond just your cardiovascular system?
That's a really good point. It's easy to get focused on one specific area of health, but everything is connected in some way. So what are some of the other potential complications that can arise from high triglycerides?
Well, one area that's been getting a lot of attention lately is the link between high triglycerides and fatty liver disease.
Fatty liver disease, I've heard of that. But I always thought that was mainly caused by drinking too much alcohol.
While excessive alcohol use can definitely lead to fatty liver disease, there's also something called non-alcoholic fatty liver disease, or NAFLD for short.
Yeah.
And it's becoming more and more common, especially in folks with metabolic syndrome.
And high triglycerides are part of that metabolic syndrome picture, right? So how does that contribute to fatty liver disease?
When you have high levels of triglycerides floating around in your blood, your liver can actually start storing excess fat. And over time, this can lead to inflammation and damage. It can even progress to more serious conditions like non-alcoholic steatohepatitis or NASH, which involves even more inflammation and can eventually lead to cirrhosis, liver failure, or even liver cancer.
Wow. So this is not something to take lightly. It sounds like it can have some pretty serious long-term consequences.
Exactly. And the tricky thing is, just like with high triglycerides, fatty liver disease often doesn't cause any noticeable symptoms early on, so it's super important to be aware of the risk factors and get regular checkups.
Okay. So we've got fatty liver disease as a potential complication. Are there any others that we should be aware of?
Well, research is starting to suggest that high triglycerides might also be connected to other health issues, including certain types of cancer, although more research is needed to really confirm those links.
Cancer.
Yeah.
Really, that's not something I would have automatically associated with high triglycerides.
It's definitely an area where more research is needed, but there have been some studies that suggest a possible link between high triglycerides and an increased risk of cancers like colorectal cancer and prostate cancer.
Okay, so that's another piece of the puzzle. Another reason to take those high triglyceride numbers seriously.
Exactly. It just goes to show how important it is to look at our health holistically. It's not just about addressing one specific issue, but understanding how all the different aspects of our health are interconnected.
Right, because our bodies are incredibly complex,
Right.
and everything seems to influence everything else. So if we want to be truly healthy, we need to look at the big picture.
Precisely. Now, you mentioned earlier the importance of working with your doctor to manage high triglycerides. Are there any established guidelines that healthcare providers use when it comes to diagnosing and treating this condition?
That's a great question. It would be really helpful to understand what the official recommendations are.
Well, there are several organizations, including the American Heart Association, or AHA, and the European Society of Cardiology, or ESC, that have developed guidelines for classifying and treating hypertriglyceridemia. These guidelines are based on the latest scientific evidence, and they're regularly updated as new research comes out.
So it's like having a standardized approach to make sure everyone's on the same page. What are some of the key takeaways from these guidelines?
Well, as we've already discussed, all the guidelines stress the importance of lifestyle interventions as the first step in managing high triglycerides. That means focusing on a healthy diet, getting regular physical activity, and achieving a healthy weight.
Okay, so those lifestyle factors are always the foundation. But what about medication? When do the guidelines suggest considering that as an option?
The specific recommendations can vary a bit, depending on the organization and the individual patient's risk factors. But generally speaking, medication is usually considered when lifestyle changes alone aren't enough to bring those triglyceride levels down to a healthy range, or if there are other significant risk factors present, like existing heart disease.
That makes sense. So what exactly is considered a healthy level for triglycerides? Is there a specific number we should be aiming for?
The American Heart Association considers optimal fasting triglyceride levels to be less than 100 milligrams per deciliter. Levels between 150 and 199 are considered borderline high, and the levels of 200 or higher are considered high. And if your triglycerides are consistently above 500, that's when your risk of pancreatitis really shoots up.
Got it. So less than 100 is the goal.
Yeah.
But if your numbers are above 200, it's definitely time to have a serious conversation with your doctor.
Exactly. And the type of medication they recommend will depend on a variety of factors, including how high your triglycerides are, your overall health, any other medical conditions you might have, and your personal preferences.
So it's not a one-size-fits-all approach.
Not at all. It's really important to work with your doctor to create a personalized treatment plan that takes all of those individual factors into account.
Now, in the first part of our deep dive, we talked about medications like fibrates and prescription omega-3 fatty acids. Are there any other medications that are commonly used to manage high triglycerides?
Another class of medications that doctors might consider are niacin derivatives. They work by reducing the liver's production of triglycerides and VLDL cholesterol, which is another type of bad cholesterol that can contribute to heart disease.
Interesting. So they work in a similar way to fibrates.
In some ways, yes. But it's important to remember that all medications have different potential side effects, and they can interact with other medications you might be taking. So it's always crucial to discuss the risks and benefits with your doctor.
Right. It's all about weighing those pros and cons
Yeah.
and finding what works best for you as an individual.
Mm.
Now, earlier we were talking about how high triglycerides can sometimes be a symptom of an underlying medical condition. If someone's high triglycerides are due to something like diabetes or hypothyroidism, how does that affect their treatment plan?
That's a great question. In cases like those, effectively managing the underlying condition is absolutely essential. For example, if someone with diabetes also has high triglycerides, their doctor might adjust their diabetes medications or recommend some lifestyle changes to improve their blood sugar control, which can often have a positive ripple effect on their triglyceride levels as well.
So it's like addressing the root cause of the problem, not just the symptom itself.
Exactly. And the same principle applies to other conditions like hypothyroidism. By getting those conditions under control, you're not only improving your overall health, but also potentially tackling the underlying driver of those high triglycerides.
It all comes back to that interconnectedness, doesn't it?
Absolutely. It's a reminder that our bodies are incredibly intricate systems, and we need to consider all the pieces of the puzzle when addressing health concerns.
Now, I know we've spent a lot of time talking about the downsides of high triglycerides,
Yeah.
but I'm curious, do they serve any beneficial purpose in the body? I mean, our bodies wouldn't produce them if they weren't needed for something, right?
You bring up a very good point. And yes, as we mentioned earlier, triglycerides do play an essential role in our bodies. They're a major source of energy for our cells, especially when we're fasting or engaging in intense physical activity. They're stored in our adipose tissue, also known as our fat cells, and they're released into the bloodstream whenever our bodies need an extra energy boost.
So it's like having a backup fuel tank.
Exactly. They're essential for normal bodily functions. It's only when those triglyceride levels get too high that we run into problems.
It's all about balance.
Yeah,
As with most things in life.
precisely. And that's where those lifestyle modifications we talked about earlier come in. By making healthy choices about our diet, getting regular exercise, and managing our weight, we can help our bodies maintain that delicate balance and keep those triglyceride levels in check.
Okay, so we've covered a ton of information in this part of our deep dive. We've talked about the potential risks of high triglycerides, the importance of managing underlying medical conditions, the role triglycerides play in our bodies, and the various treatment options available. Anything else we should touch on before we move on to the exciting world of cutting-edge research?
Yes, I think it's really important to emphasize that high triglycerides are often a silent condition, meaning that you might not have any symptoms at all until a serious complication develops.
It's a little scary. So how can people even know if their triglyceride levels are high, if there aren't any obvious warning signs?
That's why regular blood tests are so crucial. It's generally recommended that adults get their cholesterol levels checked, including triglycerides, at least every 4 to 6 years. And if you have any risk factors for high triglycerides, like a family history of heart disease, diabetes, or obesity, your doctor might suggest more frequent testing.
So those routine checkups really are important. Even if you feel perfectly fine, they can help catch things early on, when they're usually easier to treat.
Exactly. It's always better to be proactive about your health and address potential issues before they turn into major problems.
Okay, that makes sense. Now, I know we've talked about how treatment recommendations can vary from person to person, but are there any general lifestyle tips that you can share for anyone who's looking to lower their triglycerides? Like a triglyceride-lowering toolkit that everyone can benefit from.
I love that, a triglyceride-lowering toolkit. And yes, there are definitely some key things to keep in mind.
Okay, I'm ready to take notes.
First and foremost, watch your sugar intake. Limit sugary drinks, desserts, and processed foods that are loaded with added sugars.
Got it. Sugar is definitely a big no-no.
Next up, make sure you're choosing healthy fats over unhealthy fats. Opt for unsaturated fats, like those found in olive oil, avocados, nuts, and fatty fish. And try to limit those saturated and trans fats, which are commonly found in red meat, full-fat dairy products, and lots of processed foods.
Okay, so it's good fats in and bad fats out.
Exactly. And don't forget about fiber. Make sure you're getting enough fiber in your diet by eating plenty of fruits, vegetables, and whole grains. Fiber can help regulate your digestion and prevent some of those fats from being absorbed into your bloodstream.
Fiber is our friend.
Now, we talked about alcohol earlier, and when it comes to alcohol, moderation is key. If you choose to drink, do so in moderation. For women, that means no more than 1 drink per day. And for men,
Right.
no more than 2 drinks per day.
Got it. So maybe not every day is a happy hour day.
Right. And of course, regular exercise is essential. Aim for at least 30 minutes of moderate intensity exercise most days of the week. This could be anything from brisk walking to swimming to cycling.
And to dust off those sneakers.
And finally, if you're carrying extra weight, even losing a small amount can make a significant difference in your triglyceride levels. Aim to lose about 5%, 10% of your body weight. And you'll likely see some pretty impressive improvements.
Oh, every little bit counts.
Absolutely. Even small changes can add up to big results when it comes to your health.
Now, before we dive into all the exciting research happening in the world of hypertriglyceridemia, I want to circle back to the medications we discussed earlier, specifically fibrates and prescription omega-3 fatty acids. Are there any potential side effects or things people should be aware of if they're considering these treatments?
That's an important question. It's important to remember that, like all medications, fibrates and prescription omega-3s can have potential side effects. It's crucial to have an open and honest conversation with your doctor to make sure the medication is right for you.
So what are some of the potential side effects that people should be aware of?
With fibrates, the most common side effects are gastrointestinal issues, like nausea, stomach pain, and diarrhea. It's also important to note that they can potentially interact with other medications you might be taking. So always make sure to tell your doctor about all the medications you're using, including any over-the-counter medications or supplements.
Okay, good to know. What about prescription omega-3s? Are they generally well tolerated?
Yes, prescription omega-3s are usually pretty well tolerated. Some people might experience some mild side effects, like fishy burps, indigestion, or loose stools, but these are typically manageable. And there are ways to minimize those side effects, like taking the medication with food or choosing a formulation that's enteric-coated, which can help prevent that fishy aftertaste.
Fishy burps. Yeah.
Yeah.
But I guess that kind of comes with the territory when you're dealing with fish oil.
Usually it's not a major issue, and
Yeah.
the potential benefits of lowering your triglycerides and improving your heart health often outweigh those minor inconveniences.
Right. It's all about weighing those risks and benefits
Yeah.
and making an informed decision with the guidance of your doctor.
Absolutely. Open communication with your healthcare provider is key to make sure you're getting the most appropriate and effective treatment for your individual needs.
Okay, so we've covered a lot of ground on high triglycerides.
Yeah.
Causes, risks, the current treatments. But what's next? What's being researched right now that might change how we approach this in the future?
That's the exciting part about science. It never stands still. One thing that's really generating a lot of excitement is the development of new medications. These new meds target very specific pathways involved in how your body processes triglycerides. We talked about a couple of them before. apoC-III and ANGPTL3. They're really hot topics in research right now.
Right, those are some serious science words, but they hold a lot of potential. Can you remind us again why these are so important and how targeting them could really change the way we treat high triglycerides?
Okay, so imagine this. apoC-III is like a brake pedal that slows down the breakdown of triglycerides in your body. These new drugs are like taking your foot off that brake, allowing your body to get rid of triglycerides in the bloodstream much faster.
So it's like removing a roadblock that was preventing the triglycerides from being broken down effectively.
Exactly. And then there's ANGPTL3. This protein plays a big role in how the liver makes and releases triglycerides. So if we can inhibit ANGPTL3, we can potentially lower triglyceride production and increase their breakdown.
Wow, so it's a double whammy, lower production and faster breakdown. That sounds like a pretty effective strategy. Are there any drugs that target these proteins already available, or is this all still in the experimental stage?
It's still early, but the research is super promising. There are several drugs in clinical trials right now targeting both apoC-III and ANGPTL3. Early studies have shown some really significant drops in triglyceride levels. And there are even hints that these drugs could improve other aspects of lipid profiles, like raising those good HDL cholesterol levels.
So it's not just about lowering triglycerides. It's about improving overall heart health as well.
That's fantastic.
Any idea when these new medications might actually be available to patients?
It's tough to say for sure, because developing new drugs is a complicated process, and there's a lot of testing involved to make sure they're both safe and effective. But if these trials keep showing positive results, we could potentially see some of these drugs becoming available in the next few years.
Let's hope so. It sounds like we're on the cusp of some big changes in how we manage hypertriglyceridemia. Are there any other areas of research you're excited about? besides these new medications?
Oh, definitely. One area that's really gaining traction is the role of genetics in hypertriglyceridemia. Scientists are starting to zero in on specific genes that can contribute to high triglyceride levels, and this could pave the way for much more personalized treatments.
Personalized medicine. That's the future of healthcare. It makes so much sense. I mean, everyone is different, so why would we expect the same treatment to work for everyone?
Exactly. By understanding someone's genetic predisposition to high triglycerides, doctors could identify those who are at the highest risk and intervene earlier with prevention strategies or tailor treatment plans to their unique genetic makeup.
So someday, we might actually be able to predict who's likely to develop high triglycerides and take steps to prevent it from ever happening in the first place.
That's the dream. It's
Oh.
about moving away from just reacting to problems and embracing a more proactive and preventative approach to health.
That's a really powerful idea. And it sounds like genetic testing could also guide treatment decisions to ensure that people are getting the most effective medication for their specific situation.
You got it. It's all about getting the most benefit from treatment while minimizing any potential risks or side effects.
This is incredible. Genes, personalized medicine. It sounds like the future of managing hypertriglyceridemia is going to be much more precise
Yeah.
and much more effective. Is there anything else on the research front that you think is worth mentioning?
One more thing that I think is super interesting is the emerging research on the role of the gut microbiome in triglyceride metabolism.
Wait a minute. The gut microbiome, you mean those trillions of bacteria that live in our intestines? What does that have to do with triglycerides?
It's a fascinating area of research, and there's growing evidence that the composition of our gut microbiome, the different types of bacteria living there, might actually influence triglyceride levels and our overall metabolic health.
So the bacteria in our gut could be impacting our heart health. That's mind-blowing. How does that even work?
We're still figuring out all the details.
Yeah.
But it seems that certain types of gut bacteria might be involved in producing substances that promote inflammation and increase triglyceride production.
So it's like a whole ecosystem in there.
Yeah.
And if the balance gets thrown off, it can have effects throughout the body.
Exactly. Scientists are now looking at ways to manipulate the gut microbiome through things like diet or probiotics to potentially improve triglyceride levels and boost overall metabolic health.
Well, I'm definitely adding gut microbiome to my list of things to learn more about.
It's definitely a hot topic in research right now. There's still so much we're discovering about how it affects our health.
Well, this has been an amazing deep dive into the world of hypertriglyceridemia. Thanks so much for joining us today and sharing your insights.
It's been my pleasure.
And to all our listeners out there, we hope you found this deep dive informative and empowering. Remember, knowledge is power. In understanding your health, including your triglyceride levels, is the first step towards taking control and making the best decisions for your well-being.
Absolutely.
Don't forget, this deep dive is just a starting point. It's not a substitute for professional medical advice. So if you have any concerns about your triglyceride levels or any other health concerns, please reach out to your healthcare provider. They can provide personalized guidance and support. Until next time, stay curious, stay informed, and take care of yourselves.